Hello everyone, welcome to Brainwaves. Today on Brainwaves I welcome Dr. Roger Kathol. Dr. Kathol is a psychiatrist, an internist, an adjunct professor at University of Minnesota, and is president of Cartesian Solutions Incorporated. Dr. Kathol is working on the forefront of the movement to integrate healthcare, that is to say, to bring behavioral healthcare and physical medical healthcare together so that the patient can obtain comprehensive care in an efficient way. Dr. Kathol's company consults with healthcare stakeholders like medical providers and insurance companies to help this process of integration along. And he's here with us today to discuss what this process of integration means for all of us and how interested viewers might get involved in helping this process along. So, Dr. Kathol, thank you so much for being with us on Brainwaves today.
Well, thanks, Brandon.
Absolutely. I have a few questions for you, and I'll just get started. First of all, what interested you in the first place in advocating for integrating behavioral and physical medical health care?
So it really started when I was in medical school. I did a rotation at the Maudsley Hospital in London, and one of the docs there was both a psychiatrist and an internist, and he sort of got me interested in this orphan population, the people that had both medical and mental health problems. And so I ended up doing training in both and have worked with people that had combined illness for my entire career.
Great. So you're well suited for this area then, obviously. Um, what benefits do you foresee for people, and have you seen for people with mental illness specifically, uh, coming from the integration of healthcare in this way?
So for people that have mental illness, I think that the biggest issue is really access to medical care. We know that people that have mental health and substance use problems die somewhere in the range of 7 to 20 or 25 years earlier than those that don't have it. And this is really related to the fact that they have difficulty in accessing medical services in addition to their mental health service needs. And so on the mental health side, it really allows better access for people who have mental health problems to access medical care. On the medical side, the vast majority of people that have behavioral health problems actually show up in the medical setting. They don't show up in the mental health setting. And it's like 20% show up in the mental health setting, and the other 80% really have their problems in the medical setting but don't have access to services. And so the integration of services really will allow them access to treatment for their mental health problems, which in turn improves their outcomes for their medical problems if their mental health problems are treated adequately.
That makes a lot of sense. What benefits might there be for our whole nation then from this integration?
Well, the first thing is better health. People that have access to both medical and mental health services really are going to have much better outcomes for their total health than if they were treated for just the medical on one side and the mental health on the other. The second really major advantage is that by integrating services, there are now a number of studies that demonstrate that this integrated treatment leads to improved outcomes and therefore less service use. And so it actually decreases the total cost of care. The interesting thing is that people that have mental health problems actually have the greatest healthcare use on the medical side. So they use relatively little in the way of mental health services, but have huge amounts of medical service that once you get the mental health problems under control, then it decreases the amount of medical services and therefore decreases the total cost of care. So the nation really will benefit by having integrated services rather than these standalone mental health services in a completely different setting.
Yeah, that makes sense too. I mean, we all know that healthcare costs are through the roof these days, and anything to help that come down, and that just seems like it probably makes a lot of sense that it would. It would be a great help. So, who opposes healthcare integration, and Why?
So the biggest detractors from integration of mental health and medical services are the behavioral health managed care companies, the insurers for behavioral health. They make their money by separating it out, segregating it, and paying for it in separate settings. And what this means is that people that have mental health problems can't get medical services in the mental health setting. And likewise, the people that have mental health problems in the medical setting can't get the mental health services unless they go, and they really don't want to go to the mental health setting. So behavioral health insurers are dead set against it because they make their money by separating it out. Secondarily, the providers of behavioral health, since they're primarily paid by the behavioral health payers, are worried about losing what small piece of the reimbursement pie they have if mental health services were put into complete medical services, so that all healthcare would just be paid from one bucket of money. In fact, that probably is inaccurate because the amount of support for mental health services, since it does contribute so greatly to the total cost of care, will likely get better reimbursed by providing it in the medical setting than by separating it out into the mental health setting. So but the behavioral health providers are definitely justifiably concerned about losing reimbursement for services if it goes into the medical payment pool.
Okay. So then, how might obstacles to this integration, such as the ones you just described, be overcome?
Well, the first thing is that you have to really recognize that there's a problem. Many people do not think that separating out behavioral health, that is mental health and substance use problems, from medical causes the fragmentation in care that it does. And it really does. So just recognizing that there's a problem. The second thing, as far as changing the system, is really starting to think about the ways that the integration of medical and mental health services can take place. And that is, first of all, the payment for behavioral health services has to become a part of the medical benefits. So it's mental health and substance use disorder are just a part of health. They really need to be paid for just as if it were surgery or medical care or what have you. The second thing is then building the treatment infrastructure, this integrated care, so that people have access to both medical and mental health services in the same location. And so it really means putting mental health professionals into the medical setting where they're currently not able to practice because they don't get paid to do service there, and also improving access to medical services because the mental health services then become a part of the total health improvement process. So they're paid just as a part of the rest of health.
Okay, I think those would be a big step toward integrating the healthcare. So then, what can interested viewers do to help this process along?
Well, the first thing they can do is they can really recognize that this is a problem. I mean, it's really a major problem, and particularly those that have mental health issues, they really need to recognize that going to a separate location for the treatment that they get is really ultimately not in their best interest. They really need to have both the medical and mental health taken care of in the same setting. So once they recognize this, and frankly, mental health patients, and I would say mental health practitioners, once they recognize this, there are two major things that they can do. First of all, they can advocate for making behavioral health payment for services a part of the medical payment system. That will allow the integration of services delivery to occur. Right now, when it's separate, you can't pay for mental health services in the medical setting because the behavioral health people really need to control it in the behavioral health setting. Mm-hmm. The second thing is really as patients demanding that mental health services be available in their primary care doctors' offices. Rather than having to go someplace else to get the care, they really should expect that mental health practitioners who can supplement the knowledge of the primary care docs in helping them get their mental health problems better, to just be available as all other medical services are. So these are really the two major areas, advocating for payment reform and advocating for integrated service delivery. I guess I would like to say one thing about the specialty mental health sector. I mean, there are certainly people that need specialty mental health services, just like there are people that need specialty surgical services or specialty rehab services or specialty ID services. There will continue to be a specialty mental health sector. There's no question about that because there are certain needs that mental health patients have. On the other hand, the vast majority of patients with mental health issues do not need specialty mental health sector service delivery. They can get good, excellent mental health care in the medical sector and really should be as a part of the rest of their health care.
Okay, that's an incredible plan. I really admire you for working on making that a reality. So thanks very much, Dr. Kathol, for being with us on Brainwaves today. And if people have any questions for you, when I post this video on the Brainwaves page, will you be ready to answer some questions?
I sure will.
Okay. Thanks again, Dr. Kathol, and talk to you soon.
Okay, thanks a lot, Brandon. Take
You're
care.
welcome. You too. Bye-bye.